Welcome to International Conference on Research in Life Sciences and Healthcare. First, I would like to convey my sincere gratitude to ICRLSH for inviting me as a keynote speaker in this conference. I am from Institute of Mathematics and Management, Sri Lanka. Role of Scientific Forecasting on COVID-19 Pandemic is the title of my speech. The term pandemic is well known to us. Pandemic is a disease outbreak that spreads across countries or continents. It is worse than epidemic situation. It takes more human lives. That's why WHO declared COVID-19 as a pandemic situation. It is very clear that there was severe illnesses and it was spreading very fast globally. When we look at the recent pandemics, we can see there were four pandemic situations starting from 2002, Middle East, respiratory syndrome, Ebola, SARS, swine flu. Swine flu was the worst outbreak we faced recently by recording more than 200,000 death total. When we talk about the forecasting, we do forecasting to get an idea about the future behavior of a certain situation. Scientific forecasting. We use scientific approach for forecasting. That's why we call it scientific forecasting. Scientific forecasting is based on mathematical modeling. Simply, a mathematical model is an equation or set of equations. We identify the problem and put it to the mathematical formula or many mathematical formulas. That type of an equation, we define it as mathematical model. This is the process of mathematical modeling. Initially, we observed a real world problem and a mathematical model is devised. That means we identify the suitable mathematical model to address that respective problem. After that, we do predictions with the help of that selected mathematical model. Before we do the predictions, we have to satisfy the model validation criteria. Or there are several criteria to be satisfied, so we have to confirm that that model is suitable for forecasting. And we extract predicted outcomes. After that, we compare the predicted outcomes and observed outcomes. If the difference between predicted and observed outcomes is less, we can say the error, that is called error or residuals. If the difference is less or the errors are less, we can say this model is suitable for forecasting. If not, we have to go back and select another suitable mathematical model to achieve our objective. When we talk about the significance, what is the use of scientific forecasting in pandemic situations? In scientific forecasting, we can extract predicted outcomes. In a COVID situation like this, in a pandemic situation like this, we can extract predicted outcomes of number of infected cases, number of death total, number of recoveries. Based on that, we can decide, we can see the future, what will happen in the future. It is kind of an early detection of possible outbreaks and also patterns, and it will be useful to control the spread. Not only that, the scientific forecasting in a pandemic situation is useful to predict the speed of a spread. Based on that, we can impose several restrictions to control the spread. On the other hand, we can develop various strategies to control the outbreak, like optimizing antiviral strategies, optimizing immunization strategies, etc. Further, we can take initiatives by observing the predicted values, predicted outcomes from a scientific forecasting in pandemic situation. And it will be useful to take initiatives to combat a pandemic, and we can prepare to minimize the outbreak of the pandemic. And also another important factor is logistic requirement, like ICU beds, inhalers, personal protective kits. We can increase the production of those items by observing the predicted values given by the scientific forecasting in pandemic situations. And also we can enhance non-pharmaceutical practices to minimize the spread of pandemic. Now, these are several applications of scientific forecasting on COVID-19 recently. These papers published by me, forecasting daily infected cases for various countries. So these papers available in Journal of New Frontiers in Healthcare and Biological Sciences. It is clearly identified the problem. The pattern was recognized clearly. Based on that, the technique selected and the selected models validated properly, verified properly with the correct predicted outcomes. Based on that, there are several recommendations and significance was highlighted in these papers. You can see these papers in this journal. One example I want to shoot, this forecasting COVID-19 outbreak in Philippines. This is one of the example I want to explain you how to use the scientific forecasting in pandemic situations. Now, I took one country, that is Philippines. Philippines is one of the South Asian country. This country reported the second highest amount of infected cases among other countries in South Asian region. Philippines exceeds more than 500,000 cases since 22nd January 2020, still reporting a high volume of infected cases. So the behavior of the outbreak in future is doubtful. Therefore, the governors and authorities should know what will happen in the future and how to prepare, how to control the outbreak of this pandemic situation in future. Why is that? To ensure the sleek function of the country. So they have to control the outbreak of this pandemic situation. Therefore, the objective selected to forecast the amount of daily infected cases of COVID-19 within Philippines. Coming up to the methodology, the method I use for this, obtain daily infected cases from WHO database from 22nd January 2020 to 27th September 2020. After that, when we obtain the data from the database, and we have to plot the data set, and we have to study the pattern of the data set. For that purpose, we used time series plots and autocorrelation functions. Based on the pattern or the behavior of the infected cases, we have to decide which technique is suitable for forecasting. It was very clear there was a trend, therefore the trend model selected, and the double exponential smoothing is one of the most suitable and successful technique to forecast infected cases, death total, recoveries in this COVID situation. When you select the model, we have to satisfy the model validation criteria, as I told you before. For that purpose, we have to ensure the normality of the residuals and independence of the residuals. To do that, we selected the Anderson-Darling test, autocorrelation function, and LBQ test to test the normality and the independence of the residuals of that selected model, and to see whether it is satisfied the model validation criteria or not. After that, we have to measure the forecasting ability of the model with the help of measurement of errors. Now there are 3 measurement of errors: MAPE, that is relative measurement of error, mean absolute deviation, and mean square error. Those are 2 measurement of errors coming under the absolute measurement of errors. Therefore, this 2 measurement of errors, relative and absolute measurement of errors, we use to test the forecasting ability of the model. Pattern recognition is one of the important part. That's the beginning part of the scientific forecasting. This is the time series plot of daily infected cases in Philippines for the period of 22nd January 2020 to 27th September 2020. It is very clear there is a trend and exponential growth or exponential decline. Further, autocorrelation function confirms the weak stationary of the daily infected cases in Philippines. After that, by considering the exponential growth, exponential decay, the data set divided into 2 parts for forecasting purpose. The data set break from 8th July to 27th September. And again, we test the behavior of the series. So the pattern recognition for that part, you can see by time series plot. It is very clearly explained the trend, increasing trend of daily infected cases in Philippines. Further, the autocorrelation function once again confirms the weak stationary of the series. As I told you, based on the pattern recognition, there were 2 types of models selected. That is linear, that is trend models, and double exponential smoothing. Starting from trend models, 4 trend models tested: linear trend model, quadratic, growth curve, and Pearl Reed. All these models were failed. This model doesn't satisfy the model validation criteria. Therefore, none of these models were suitable to forecasting the spread. Then move to another technique. The next one is double exponential smoothing. The weights assigned for level and trend, that is alpha and gamma, 0.77 alpha, gamma 0.77. Model was selected, fitted. It confirms the normality of the residuals and independence of residuals. That means that model was suitable and that model satisfied all validation criteria. The measurement of errors under the fitting was very low, and after that we need to verify the model. The same here, all measurement of errors confirms the model is suitable to address this problem. That means to forecast infected cases, daily infected cases in Philippines. Here is the further confirmation of the model validation criteria. Left graph confirms the normality of the residuals. Right graph confirms the independence of residuals. After that, when we extract the predicted outcomes, we have to compare the predicted outcomes with observed outcomes. Actuals versus fits and actuals versus forecast. These 2 graphs confirms the fits almost follow the actual series, and the deviation between fits and actual was very low. That means the error was very low. With that, we can conclude this double exponential smoothing alpha 0.77 and gamma 0.77 is the most suitable model to forecast daily infected cases in Philippines. Applying scientific forecast in pandemic situation is a practice. Applying scientific forecast is a practice. If you practice more, you will end up with perfect outcomes and perfect results. So that's all about it from anything you need to clarify, you can ask. So you can contact me for further information. Here is our website. Thank you very much. So thank you once again to the ICRLSH for inviting me. Thank you so much.